Hello and welcome back to A Better World. This is your host, Mitchell J. Rabin, and we're very glad that you're joining us again today. Today we're going to have another very interesting. We're very pleased to have Jaclyn Johnston on with us, who is a healer. She's got a very interesting background, and she'll be sharing with us some of her background and what it is she's doing today. Jaclyn has been working with people across the country in all echelons when people, dancers, basketball players, and others get injured in the professional world. Well, they need to be able to rely on people who can come forth quickly on the spot and help to heal them. You know that I have had a number of people on the show who have seen it over time that are healers who have been putting their hands on people and healing etheric bodies, astral bodies, causal bodies, etc. Well, Jaclyn is among them, and I have to say I believe that she is one of the better among them. Many people claim to be healers and put themselves out professionally, and many should. There is another level, however, of people who are really very good and who are really getting results. So on that note, I want to thank you for being on the show, Jaclyn.
Thank you.
Absolutely. And what I say, I feel, is really very true. I have met many healers, both in my life as a psychotherapist, acupuncturist, and in the healing arts myself, as well as through doing the television show. I don't want to tell you how many I have met. They come out from the woodwork. And it was really a pleasure for me to be on the table and being worked on by you today, because I felt really an extra sense and of competence and involvement with the healing. I feel like something is really going on with you, distinct from what else I've experienced.
Thank you.
Absolutely. So what is it that you were doing that got you then into this line of work?
Investment banking. Working on Wall Street, MBA background.
Great.
But I had a closet life that people didn't know about, which I was studying healing for an extensive period of time.
Mm-hmm. And
it was a passion, and the draw to do it professionally just became stronger and stronger, till ultimately taking the step and putting myself out there.
Beautiful, beautiful. So you just let go of the investment banking industry and Wall Street and stepped into this field.
It's been a year of transition, yes.
Oh, yeah. So it's relatively recent that you have left that on a full-time basis. Yes. Wow. It takes courage to do that, doesn't it?
Yes.
Do you feel that's the case? I mean, are you aware of what it took to
It's a radical change. It's working in a totally different way. A corporate career oftentimes involves the left brain. This is working much more intuitively, really sensing the way. I've got a lot of training, but when I start a session, even people with the same disease or same type of problem, the treatment still can be very different because I work very intuitively.
Mm-hmm. What has your training been when you say you've gotten training?
I've worked with Barbara Brennan. She has a 4-year training program.
You went through that program?
I went through 3 years of that program. Mm-hmm. And I worked with Fuentes, who's a master healer. She's worked with 13 different masters throughout the world, and that's a pretty rare background.
Yes. We've had Star on the show.
Yeah. And Gary Douglas, who's the founder of the Access System.
Yes.
Had lunch with him today.
You know Gary, too.
Yes. And
we've had Rasputin on the air, after all.
And those are some of the key people.
I see.
But I've been very fortunate to work with a number of people.
Wonderful. Wonderful. And so what happens when you are working on someone? What is it that you are reading in their field, and what is it that you find yourself responding to?
I usually work from the feet, which is very unorthodox, and or sometimes lately I've been touching this area here, the shin area, and starting to connect with the bone marrow, which revitalizes the entire physical system. Mm-hmm. Then oftentimes I work from the bottom of the feet, because I can work with clearing the energy throughout the entire body, working upward through the body. And I can work on a chakra level, opening, balancing, really amping up the chakras. And it's usually at that point that I start to feel, where are the blocks in the system, and I start to get some information psychically oftentimes, or start to see in my mind's eye different blocks and have an awareness of what could be an issue. And then I just instinctively work in that area. Or if there's multiple areas, sometimes it's a lesser important one first, moving into the most important block in the person's system.
Now you have worked with people with very serious conditions,
Yes.
such as brain cancer, for instance. What has happened? Is this one patient in particular?
No, it's several. Moving into the cancer as a specialty or an interest has been rather recent, but there have been cases over quite some period of time.
Could you tell us about one or two of them?
Sure. Well, there's a very recent one we don't have full information on just yet. Someone came to me this past month with a brain tumor that was 3 centimeters, and we had a session, and I had the impression, it was one of the ones that I really felt like I was working blind, which makes it tough for me to give very much feedback, especially in such a case where there could be such serious repercussions.
Yes.
So
when you say blind, what do you mean?
That I didn't have much clairvoyance, much psychic sight or awareness of what was happening during the healing session.
You weren't picking up on.
Right. It was, for me, my personal experience was much more like holding a frequency and just staying with that for the work to be completed. And it wasn't any type of technique that I was aware of being trained in. And all I got for guidance at the conclusion of the session was seeing like a bright light, like a candle flame, and then I saw the diffused light move into one light, which was stronger, a bit bigger, a bit brighter. So there was some sort of condensing effect, which I didn't quite understand. And then I heard the phrase, the cancer is not a problem. But that's not much to tell someone for them to feel secure. So we had a conversation about what could be done. Traditional brain surgery, which he had had before. It was a recurring situation, same place, appeared to be the same type of cancer. And he decided to go ahead and have participate in an experimental program with Columbia Presbyterian Hospital. And the morning he was about to do that, he had some pre-operation procedures, including some MRIs. And the timing appeared to be extensive, and then his doctor told him that he had some bad news to share, that the cancer was spreading too rapidly for him to be eligible for an early stage cancer treatment, and which was quite disappointing. So they went ahead and had traditional brain surgery that afternoon. And it's still very early, and we don't have the full medical results yet, so I don't know what the full answer on this is going to be. But the early analysis appeared that it wasn't a malignant tumor, nor was it live. It was a mass of dead cells, which was quite a surprise.
Interesting. And how long had you worked on him?
Just once.
Just once?
Right after the first MRI results showing that it was 3 centimeters. And it moved from 3 centimeters to 5 centimeters in less than a month.
Wow. Has there been anyone else that you've worked on with something as serious as this?
Other cancer patients, yes. Yes. A number of cases with spontaneous remission.
Really?
Usually one treatment.
Could you
one case where the tumor actually manifested outside of the body. One case where there was a block in the intestines, and that manifested outside of the body. The tumors manifested outside of the body.
They literally broke through the skin?
Well, my impression of how that works is that to work with that, you really go up in levels in terms of dimensions. And it's a curanderos technique from the magic healers. They're called the magic healers, high in the mountains in Mexico.
Sure.
And through Fuentes, I have a bit of exposure to that. And I think it's our affiliation. I sort of picked up how to do that. And in one case, we were working together.
But are you saying that did you have the tumors in your hand at the end of the session?
No. What happens is you really go up in dimensions, and you work with it at that level. That's where the work is really done. And I think in Mexico, there's some need for people to actually see the results, to believe the results, and to maintain the results. So what happens is a tumor,
I think all over
right,
people are that way.
Right. But the tumor will manifest outside of the body. And that can take any form. You could be working on a massage table with a person on top of the massage table, and then after the session, you look underneath the ground, you make sure it's very clear first before you start, and then suddenly there'll be a material there.
Fascinating.
Right.
Fascinating.
Right.
So you really have a tendency toward working, or a desire to work with cancer in particular?
I feel very drawn to it right now. But there's been several times that this has happened where suddenly I'm working on cartilage cases, then suddenly it's cancer. I feel very attracted to this right now.
To this, and you had mentioned
right.
before the interview you're interested in bone and working
very
with
much
bone marrow.
Very much so. I think by working at the bone marrow level that you can really speed an injury. Very, very much so.
Yeah.
And if it's a fresh injury, that healing can happen very, very rapidly.
Now, could you give us a couple of examples of some of the people you've worked with, some professional athletes and dancers?
I don't think so at this time, because I've not cleared with any patients to use their names.
Right, no, I don't care about their names, but I just care about the results. What can you tell us about what has happened so far? I mean, somebody came to you with a broken bone, or injured, or what?
Well, I can think one case that's not that particular category, but working with a tendon damage. And by working in a certain way and running the energy, the tendon, that had been severed, reconnected.
Wow.
And when that does, it lines up perfectly, so there should be complete healing.
Wow.
That can be done. And when it feels very electrical, in my mind's eye, I see oftentimes blue light shooting through that, and when it starts to connect, it's normally quite painful. And then it's almost like a hose, someone stepping on a hose, where the flow is impeded, the energetic flow is impeded, and then it starts to open. Usually the person's feeling like sharp, almost electrical impulses as that's happening. When that opens up and clears, I've had 2 experiences of that, the tendon damage is fully corrected.
Isn't that incredible? I should have shown you my wrist. People know I broke that wrist a few years ago, and it never healed completely because I was out in the boondocks of northern Ontario on a men's trip, and we spent days getting as far remote as we could when I fell. And this happened, exactly. So I could either weather it and wait until we got back onto shore, or, kind of be a party pooper. I decided someone knew some Reiki and one thing or another. None of it worked, believe me. I've had experiences with healers. And nothing really made a difference. And the bone never set. Well, it started to set, but in the wrong position.
Started to set, but not, yeah.
Exactly. So it never quite got to its normal condition. But
well, the easiest time is when you work with it when it's just happened. That's the best time. But obviously we're past that. Yeah. And also, if I can just say for the viewers, if something like that does happen, just be aware of your own healing abilities. An injury like that, I would work above the injury. I would really connect with the bone, feel it, sink into the bone marrow level. Really starts to revitalize. You oftentimes can start to feel electrical charges running through it. Don't be afraid to grasp quite tightly and to really feel, really make connection and really feel that. If you've just had an injury, there is so much power coming through your system with healing energy. And your body knows, your body's very, very intelligent, knows what the perfect state is, and will just start to find that.
Exactly.
So a lot can be done.
That's
like
wonderful.
I really believe, like in mothers, and have a small child, have an accident, a mishap, and they'll pick up the child and maybe hold the child to the mother's heart, or start to touch the child in such a way, and then suddenly there's not a problem.
Yeah.
The heart connection is an important point too.
Yes, indeed. It's almost like the child gets flooded with love, which is energy.
Right, absolutely.
And especially a mother's energy, and it just, in a sense, flushes out whatever the problem is, or vitalizes those parts that have been injured or traumatized. Yeah, that's a very nice point. I think there are going to probably be a lot of people who are very interested in being able to get in touch with you. So I'd like to give folks your phone number.
Sure.
Would you like to tell people what it is?
Sure. It's in the New York area. It's 212-877-1234. 1214.
Say that one more time.
Okay.
For the sake of everyone.
Sure. For those running for a pencil. 212.
Yes.
877-1214.
Wonderful. Good. This is very good advice, Jacqueline, about people working on themselves. Not to mention the underlying point, which is that everyone is, by definition, a healer.
Absolutely.
Because nature is really the healer, from my point of view. Nature / God. And so when we allow that to be true, then we are participating actively in reality, which is that nature is healing us all the time.
Absolutely.
Literally all the time. Yeah.
Right.
And even if we're in the way, actually, nature is doing her thing through us. Knitting, literally, if you think about the trillions of enzymatic reactions going on in the body at any second, a lot of this is healing. Knitting tissue and fixing, based, and our minds are not even aware of a fraction of what's going on. And that's all healing. And God, if we bring our minds into it, then you're really packing some punch, And clearly you're doing that. Yeah.
And regarding that wrist.
Oh, yes. Back to the wrist.
I'm happy to help you with that. I think some work can still be done on that.
Oh, great. Great. Oh, that's very exciting. What is it about the bone marrow level that moves you, if you will?
I'm not sure. It just feels very powerful and very effective to me. It's a way of revitalizing, energizing the entire physical system. And it's a way to work on the quite precisely on a specific physical injury. And I just work right above the point of injury, not right on the injury, but right above the point of injury. And it channels a lot of energy directly
down
into it's like jump starting.
Yeah.
So directly into the injury. And I don't worry too much about technique. I just worry about grounding the energy, bringing it through purely, and honestly, I think the body heals itself.
Yes, indeed.
Right.
Yes, indeed.
Right.
Wonderful. Intuitively, because I've been involved in healing for many years, in Chinese medicine, the brain is called the Sea of Marrow. And marrow and bone are the building blocks, if you will, of the whole system.
Right.
Not only according to the Chinese, but also to us. And it's also related to the kidney, which is our essential energy. Jing we get from our parents. That's our most ancestral, most fundamental energy of the body. It builds bodies. So that you have an initial kind of intuitive attraction to that level of bone and bone marrow shows that you're working with and you're being attracted to, in a sense, the right place. It's dealing with the most fundamental parts, the building blocks of a physical body. So I think you're right on target. Not to mention blood production.
Yes, exactly.
And so that's the liquid bone, if you will. Never put it that way, but in a sense you could say it's the stuff, the essence of bone that's getting a chance to be liquid and then therefore move and nourish the entire body and all the cells in the body. Yeah. Why don't you tell us a little bit, if you would, Jacqueline, about some of the cases that you feel you've worked with that you're most proud of, that you feel best about the results from? People love hearing about, that person came with cancer or with this or that. Because cancer also, if I may say, while you're thinking, is such a word that has taken on such monumental proportion, which is really a distortion, because it seems that, and we've certainly been told that cancer is a very naturally occurring cellular behavior, and it's not normal, it's not desired. However, it happens under certain kinds of conditions. And the body, a healthy immune system, is dealing with that kind of cellular behavior all the time. In fact, there was a study done in Canada many years ago that showed a person's blood profile after they had ingested pork, and it looked like the person had cancer. 20 minutes or so after it had cleared, the blood went back to its normal condition. So we pass in and out of different states of consciousness and of body consciousness and body health or ill health all the time. So I feel that you are grappling with it on the level of hands-on healing is very noble on the one hand, and it also shows no fear or little fear in dealing with what for our allopathic medical doctors is something almost insurmountable.
I think a lot can be done in the field of cancer. And I'm still early on in my practice with it, but I'm just starting to really see the results. And I think some types of cancers are easier to work with than other types of cancer. The more localized cancers, I think, are oftentimes easier.
Such as?
The brain cancer, lung cancer, ovarian cancer. I think pancreatic is really quite difficult. That's an idea.
Have you worked with someone with ovarian cancer? And what has happened through the...
Spontaneous remission.
One session?
A few minutes.
A few minutes. Is that fascinating? Now, how do you relate to what it is that brought on the cancer to that proportion in the first place? And how is your treatment relating to
Frankly, that question fascinates me. I really love to work with the person and start to get a sense of what could have created the disease. Because although we've talked about clearing, there's also the issue of can it come back? Will it come back in the same form? Will it come back in a different form? And if you don't treat some of the root causes, that well could happen.
Exactly.
So I think it's important to have more follow-up care.
According to a very fine tradition, the pleomorphic tradition and the work of Enderlein and others in Germany, our bodies, actually going back to Beauchamp, our bodies are referred to as terrain. And we can either plant healthy seeds in it or not. And it can be healthy soil for seeds or not healthy soil. If it's unhealthy, then any number of diseases can begin their processes of degeneration. And we would become ill and possibly develop something like cancer or whatever. But if the terrain is healthy and well-maintained, well-oxygenated, happy, etc., then the chances of exogenous pathogens coming in and affecting are at an all-time low. So if someone comes to you with ovarian cancer, it's probably a result of many years of degradation of their system based on...
That's one cause. I believe there are other causes also.
I do too. I'm not saying this is a single cause. But what often happens is that there is some degeneration that's been going on. Cancer doesn't usually happen really quickly. I mean, no doubt there are some cases, but often, biochemically at least, it's a result of a process. So you're removing it so quickly. It's interesting.
Well, if someone is proactive in their treatment, does like an energy balancing session, you can oftentimes feel cancer out here. You can feel it in the field. And as soon as you feel it, it's just a vibration that's lower, that just because of practice I recognize it. And it's just a matter of touching into it. It's gone in less than a second.
That's incredible. That's incredible. So you are...
It's just a matter of feeling it, finding it, feeling it, matching the frequency of it, and it disappears.
Wow. So it's sort of like your body is acting as a radionics device, if you will, which is the real radionics device anyway. That's fantastic. You've also, I've heard you mention, do surgery. Like this morning you did surgery in 2.5 minutes. Could you tell our audience about that?
Well, that seems a little showy to say it that way, but yes, and on this case, I don't have medical results, and I'm really starting to work more with medical doctors so that I do get the documentation and I have a fuller, more complete picture. But in this case, it was someone who came with basically she called it a tipped womb, and we worked on it for literally a few minutes, and it was very easily discernible and very easy to read, where they're literally, instead of the forward tilt, started to reposition naturally. And interesting for me, for both of us, I really felt like the connection through her whole body, where it connected to the pituitary gland and also connected through the feet. It was interesting that it came through that way. And then I felt the restructuring, and I don't think the whole procedure lasted more than 10 minutes or so. This is something she's been plagued with for quite some time. It's really become quite painful, activated and painful. And I just happened to be there when,
yeah,
in
so
a
to
difficult
speak.
moment.
Right. So
Right.
it was a structural realignment, essentially,
Right.
that allowed the tip to untip.
Right.
Isn't that interesting? Wow. So,
And I couldn't tell you how it's done. It's just in this case,
but you
there was the
described,
clairvoyance. I saw it happen, and I was talking to the patient. She was a healer, and was perceiving exactly the same thing as I was. It just happened very quickly.
wow. But you described what you did as surgical. Is that so?
I guess technically.
I don't care. I mean, it's just, it was the word I heard you use. So it's interesting from a hands-on healing point of view, because after all, we've got the Filipino surgeons who don't use scalpels. So is it along that line that you're in a sense referring? Or is it an etheric surgery?
Etheric.
Fascinating. Let's give your phone number again.
Sure. It's 212-877-1214.
Okay, one more time, because everything happens in twos and threes.
Okay. Again, it's 212-877-1214.
Wonderful. I'm really glad to daytime. Leave a message. It's really pleasing to me to be with somebody who's doing such unusual, creative, and inspired work as you're doing. And based on our conversations, it's clear that many people are responding to you of all levels of society. And I think this is really a feather in your cap of the kind of effect that you're having on people.
Thank you.
Absolutely. And I want you to keep going. We need people like you really going on.
I intend to.
Huh?
I intend to.
Yeah, this is very good. Who are some of the, I don't mean by name, but some of the kinds of conditions and some of the kinds of folks that you've been working with? And I've just got another minute or so.
Sure.
Give us some idea.
Really tremendously.
Only because it's fun.
Tremendously varied. Cartilage replacement situations, people looking at hip replacement surgery, cancer cases. But I need to tell you, on the other extreme, people have come to work out, to stay married decision or career issues.
Psychological, emotional, counseling.
Exactly. And it's so easy to work with energy that sometimes a prolonged procedure in terms of a traditional therapy process can be handled perhaps in one session. I've had a number of cases where that's happened.
Wonderful. That's wonderful.
And I always work in a very empowering way so that the person really sees it, not me telling, not like a psychic, but using the energy as a means of the person seeing for themselves what's the optimal decision.
Wonderful.
Yeah.
That's great. And I heard you mention that there are a number of people in the entertainment industry, in fact, that have found out about you and are knocking on your door.
Those have been some of the more fun, interesting cases this past year.
Yeah. Well, I hope they're entertaining. At least. Well, thanks again, Jacqueline, for being on the show.
You're welcome.
Absolutely.
You're
I wish you a
welcome.
tremendous amount
Thank
of
you.
luck in what you're doing, and we'll be in touch.
Great.
For sure.
Take care of that wrist.
All right. With your help. Very good. You can reach Jaclyn Johnston if you'd like at 212-877-1214. 212-877-1214 if you want to get more information about her work and what she's up to. So thanks so much for joining us. This is Mitchell J. Rabin, your host, and you can always reach me at 212-420-0800. I love hearing from you, and I look forward to seeing you all next week.